Hi, I'm Bill Logan. Welcome to Physician News Network. There's helpful news if you're one of the millions of Americans suffering from chronic back pain. The FDA has cleared a procedure that has many patients saying goodbye to back pain without drugs, needles, or surgery. In our feature story, we'll be introducing a medical breakthrough. It's called non-surgical spinal decompression. With us during this program, we've invited an authority on the topic, Dr. Frank Liberti, founder of Spinal Aid Centers of America, and local spinal aid provider, Dr. Howard Goodman, D.C. Have you had multiple opinions for a back problem and are still living in pain? Do you sometimes feel when it comes to your chronic back pain you don't know where to turn or who to trust? Find out who's a candidate for this procedure and more. Stay tuned. Physician News Network is next. Welcome back. Joining us now is Dr. Howard Goodman, D.C., who practices in Midtown Manhattan in New York City. Dr. Goodman specializes in non-surgical spinal decompression and has been utilizing the latest in pain reduction techniques in his Park Avenue office, successfully treating thousands of patients since 1998. Welcome, Dr. Goodman.
Thank you, Bill.
I got to ask you, how did you get into this in the first place? What got you interested in this non-surgical spinal decompression?
Well, it's interesting. I graduated chiropractic school in 1997, and I opened up my office in 1998. And in 2000, I had while playing football and moving furniture around, I herniated a disc in my back so bad, and I like to show this story and share this story with my patients, that I went through all the epidural shots, cortisone shots, medicine, all those things, physical therapy, and chiropractic. Nothing helped me. And then one of my friends in 2004 got involved with spinal aid and using spinal decompression. And his approach and this whole system really worked to help correct my problem. And I was like a born-again person with this. It really saved the quality of my spine. So it was a personal thing that led me to this. And then wanting to share with patients this story and getting them better has been a personal mission of mine.
Doctor, heal thyself, now heal everybody else. You've done a lot of research, a lot of homework on this, and spinal aid really is a system, a protocol, an all-encompassing synergistic approach that really works.
Correct. There's a lot of problems that I find with other people now buying decompression equipment and using it in their office like somebody would use a hot pack. They're not using it properly in a lot of cases. I know so because we're getting referred a lot of these patients. They're coming to me because they know that spinal aid is nationwide. They know that this is a system that works. And the difference between us and the other offices is our commitment in my office, my commitment to make sure that the patient has every single option open to them. Before we even begin, I want to find out if they're going to be stabilized, if their body's going to be working right. And we do a whole bunch of corrective exercises and stabilizations to get their body working so that when this decompression is done, it holds. And that's the big secret and the difference between our center in my office and also the other offices. This is the difference.
What are some of the other things that you would put into place or recommend or prescribe along with the decompression techniques?
Well, I got to say this. You know, I tell patients this too. This is not a miracle for everyone. Everyone is unique. It's like a fingerprint. Okay, everyone's problem is like a fingerprint. So every person is different. And knowing that, when people come into our office, I really need to know if they're a candidate for the table. I need to know if they're a candidate for the therapy. And what we do is we do other things to help them, such as core stabilization exercises, utilizing special bracing that we utilize through spinal aid, that we can measure the patient and put an orthotic brace on their body to hold them in a state of decompression after the session is over. That's a unique part of what we do. And also many, many different types of things. There's something called neuromuscular re-education, which actually fires off hundreds of muscles that are stabilizer muscles in the body when they're done with the table. We use these types of things.
What sort of person would come in and be a candidate for this? Is this necessarily someone who has tried everything else as you did, or is this someone who's just feeling like, you know, I've got this tweak that's it's not getting bad, but I don't want it to get bad? Which is going to work better for them?
What we do is when we check a patient out, when we talk to a patient on the phone, when they call us, We want to know what they've been through before. To answer your question, it is great, and if we could get people to come in before they need those other things, it's wonderful. But in reality, you know, this is so new and so undiscovered that people really, you know, they need to see for themselves kind of thing, that usually the patients that call us are, you know, people that are pretty much suffering a lot.
One way or the other, you'd like it to be their last stop.
Correct. I'd like this to be their last stop, and in most cases, they're doing very, very well.
Now, when you have these treatments put together with the core strengthening, with the stretching, this is something that not only affects their ability to do the simple things, but also to get back into the swing of athletics or to do maybe activities that they hadn't been able to do in a long time. Is there a point where you, as the doctor, have to say, whoa, 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 hold on a second, not so fast, because we don't want to undo the good work? And how do you deal with that?
Well, you know, it's frustrating. We have a patient that I treated him last year, and he actually has a neck problem. And he was doing great. We have not seen him in months and months and months. And he came in and he said, you know, I'm a little stiff today after months. And we said, oh, my goodness, you know, it didn't work for you? And he said, well, wait a second, Doc. He says, I didn't tell you this, but I'm running in the marathon. And he's been training for a marathon.
And so he was probably up to, what,
so
18, 20 miles of
20
training?
miles. He was doing 20 miles twice a week to train for the marathon. Now, I'm not saying everyone after the treatment is going to be able to go out and run a marathon, but the fact that this gentleman did is nothing short of a miracle, I think, in itself.